Graduating from an offshore Caribbean medical school is a similar process to graduating from any accredited medical school. However, there are certain specific requirements and steps that you will need to follow. Here's an overview of the general process. Research and choose the right school. Ensure that the medical school is accredited by relevant organizations like the Caribbean Accreditation Authority for Education in Medicine and Other Health Professions, or CAMHP. Also, make sure the school is listed by the World Health Organization's World Directory of Medical Schools, or WDOMS. Check the Educational Commission for Foreign Medical Graduates, or ECFMG website. Please go to the ECFMG certification overview. This is crucial for your degree to be recognized internationally. Try to go to schools that already have financial aid from USA FAFSA. If you are not accepted to those schools, then you can go to the other schools that require you to have your own funding. There are multiple ways to do that. Review the curriculum to ensure it aligns with international standards. Many offshore schools have clinical rotation partnerships with hospitals in the US or other countries. Look into the school's student pass rates for the USMLE, or United States Medical Licensing Examination, and the school's overall reputation in the medical community. Complete the basic science curriculum. The first part of your education involves completing the basic sciences, typically including courses in anatomy, physiology, biochemistry, microbiology, pharmacology, pathology, and behavioral sciences. This phase typically lasts about 2 years with a mix of classroom instruction and laboratory work. You will need to pass exams and assignments which can be administered internally by the school. Pass USMLE Step 1, or equivalent. Many offshore schools have a pathway that leads to sitting for the USMLE Step 1 exam, or equivalent exams depending on your location. This is a critical milestone for students in the US-oriented medical system. Step 1 tests knowledge in basic medical sciences and is crucial for progressing to clinical rotations. Some Caribbean schools have high USMLE pass rates, which may improve your chances of matching into residency programs in the US or Canada. After completing the basic science curriculum, you'll move on to clinical rotations. These typically last about 2 years. Clinical rotations provide hands-on experience in various specialties, such as internal medicine, surgery, pediatrics, psychiatry, obstetrics and gynecology, and more. Many Caribbean medical schools partner with hospitals in the US or other countries to provide clinical experience. These rotations are often done in teaching hospitals that offer direct interaction with patients under the supervision of experienced physicians. Pass USML Step 2 CK, which stands for Clinical Knowledge, and Step 2 CS, which stands for Clinical Skills. Step 2, CK focuses on clinical knowledge, assessing your ability to apply medical knowledge in clinical settings. The clinical skills requirement and communication skills requirement can be satisfied by Step 2 CS or by satisfying the requirements of an ECFMG pathway. Check the ECFMG website. Please go to ECFMG Certification Overview. Step 2 CS involves patient interactions, where you perform physical exams, take medical histories, and demonstrate your ability to work with patients. These exams are critical for advancing to the next phase of medical education and for applying to residency programs. Start looking at the process for applying to residency. While in your last year of medical school, or after graduation, you will need to apply for a residency program. Most offshore Caribbean medical students apply for residency programs in the US through the National Resident Matching Program, or NRMP. The residency application process often includes submitting your USMLE scores, a personal statement, letters of recommendation, and sometimes interviews. Complete requirements for graduation. Medical schools will have specific graduation requirements such as completing a minimum number of clinical hours, passing internal exams, fulfilling elective requirements, and demonstrating proficiency in certain skills. Graduate and obtain your medical degree. After successfully completing all coursework, clinical rotations, exams, and graduation requirements, you will receive your Doctor of Medicine or MD degree, and be considered by the ECFMG as an International Medical Graduate or IMG. You can then apply for your ECFMG certificate so that your MD degree is officially recognized in the USA.